Hello everyone, welcome to my channel Daily Drug Info, and don't forget to subscribe Daily Drug Info to watch new videos. Today I will describe drug Azithromycin and its classifications, indications, dose, strength, pregnancy status and adverse effects. Drug Azithromycin, its classification is a macrolide antibiotics. Indications are chronic bronchitis, acute otitis media, bacterial sinusitis, community-acquired pneumonia, gingival urethritis, infections of skin and or subcutaneous tissues, uncomplicated. Doses in adult, bacterial infection 500 mg once daily or 500 mg on day 1 followed by 250 mg day on days 2 to 5. Gingival cervitis urethritis dose single 2 gram, and in pediatric doses bacterial infection 16 years and older 500 mg on day 1 followed by 250 mg day on day 2 to 5. Age 6 months and older 10 mg per kg on day 1 followed by 5 mg on day 2 to 5. Strength are available: capsule formulation 250 mg, powder for oral suspension 200 mg per 5 ml. Pregnancy status B. Adverse effects are abdominal pain, diarrhea, nausea and vomiting. Thank you.